Dr. Murthy, since you're here, I don't want to let you go without you helping tell our audience what they need to be thinking about.
That physically distancing ourselves from other people is essential right now. That means hand hygiene and hygiene overall is essential. So if you're out there wondering, what do I do in a moment like this to keep myself safe?
Yeah.
I would say washing your hands is absolutely essential, especially when you go outside. Washing with soap and water for at least 20 seconds. Second, using hand sanitizer when you don't have soap and water is important. Third, keeping your distance from other people, including when you greet them. Avoiding handshakes and going with non-contact greetings is important. Staying away from concerts, from bars and restaurants is incredibly important right now, as hard as it might be. And finally, making sure that you are not touching your face, especially when you are outside, is important, because the main way the virus will get in, often to our system, is when we touch our nose, our mouth, or our eyes. So these are steps that we can take to protect not only ourselves, but also other people who rely on us, people who are elderly, who may have other underlying conditions like heart disease and diabetes. They need us to be responsible now to help keep them safe as well.
Oliver, it occurs to me that repeating those basics, this is actually a time where you want to be repetitive, where redundancy is very, very important for the press.
It's so important. I think people who have tuned out of this for so long haven't really heard that message. I think that message was concise. It provided people with everyday things they can do to help reduce the transmission of the virus. And I think we really, frankly, need a lot more of it in the press today who have not been tuned in. They need to hear the message you just heard on how they can protect their family and themselves.
Yeah, I think so.
Yeah.
Thank you all.